Hi, I'm Bill Doherty. I'm your host on Hands On Harwich, and today we have Paula Champagne from our health department here in Harwich. Paula, welcome.
Thank you. Thank you for having me here today.
Paula, one of the things that's always a mystery to folks is that we have health agents, health departments. We have health screening at the state, at the federal level, and at the town level. And of course, we know that they all sort of fit together. Perhaps you could tell us a little bit about, from a, let's say, what I'd call a niche point of view, where does the town's health department and operation fit in and all of that?
Okay. Well, as you're probably aware, Bill, Massachusetts is very unique in many ways, and one of them that they're very unique is in their health departments. Massachusetts, the Commonwealth, has home rule. It's a home rule state, so local health is managed at each city and town in Massachusetts. So while other states may get their power from a state health department, each town has its own autonomous control over its Board of Health. And that's set up in the charter, whether you want to have the board elected or appointed. And your next question was, the part of that question was, what's the difference between a board and an agent? In Harwich and in every community, you have a Board of Health. That's the policy-making board. And I am the health director, I'm the staff. I enforce the policy and do all of the day-to-day inspections.
Well, Paula, in your past life, I believe you did the same function up at the county. Now,
there's another very unique situation.
My observation is that the county and the towns, work closely together as far as looking at what I'd call both how the towns could work together, but at the same time they are independent of each other.
They're independent, but they're blended. The county health department, as you are well aware of being a commissioner for many years, the county health department is the only county health department in New England. And that was set up and very unique to Cape Cod. Back in the day when we were very small communities, all of the inspectional services were handled out of the county health department. And I was one of those inspectors. I started there and put in 8 years at the county health department, very good years. And as our communities have grown, each town has gotten to the level where they needed to have their own full-time staff.
As we look at a full-time staff here in Harwich, what are the kinds of things that you address as part of your job?
I tell people, you name it. It is everything that you can think of in community sanitation and environmental health. We're doing all of the very traditional role of infectious disease, disease prevention, all of the community sanitation, food service. We inspect all of the restaurants.
Are you a sanitarian?
I am.
Okay.
I am a registered sanitarian. It is a professional licensure, like an RN or a PE. I have my bachelor degree, and then you sit for special boards to be able to have those exams. So we do all of the food service, swimming pools, beaches, all of the complaints on housing, safe and sanitary housing. We are advisory to the selectmen and on the landfill. As far as environmental health, we're involved in everything in construction as far as septic systems, water quality. We've been involved in the wastewater planning. And we're very much involved with all of the emerging diseases over the years, things that I never knew before I started in public health, HIV, AIDS, H1N1, SARS, radon.
We used to dig a hole in the ground and build a home to take advantage of the higher temperatures that are year-round, until we found out that you were exposing people to radon. It was like one thing. You got a benefit, then you had the detriment. You mentioned water and water quality. We have town water here and we have an excellent water department. Do you work with them?
Yes, we do. We work with them and advise them if there's any reason for we work together with the testing program. We're aware of the water quality. if there were to be an incident, we would be called in on an emergency basis. We're not working with them on a daily basis, but again, we're the public health advisor to many of the departments in town.
Well, those of us who are on town water, have the benefit of that protection. Are there any significant areas that have well water in the town?
We still do have well water in town on some of the East Harwich, on some of the far reaches of town, up here in the Pleasant Lake area, as you get around Hinkley Pond, around Long Pond. So we're probably about 85 to 90% town water, but we still have pockets of well water.
In advice to people with well water, how often should they test their water?
They should test that every year. And as you know, we have a wonderful service at the Barnstable County Health Department.
Oh, yes.
Oh, yes. Oh, yes. We have the Barnstable County Laboratory, which is a very economical service, a wonderful service for all of our communities to be able to take advantage of. They test all of the town water supplies. Our water supply in Harwich is tested on a weekly basis. They test multiple distribution points throughout town. They also, the county health department, tests all of our bathing beaches and ponds on a weekly basis. That's a huge program that we have to undertake
yes, it
in
is.
the summer.
I know we hire extra people during that season. Well, so clean water. How about the air? Do you do anything on testing air quality?
We do not. Again, we are a small health department, and that's a service that is managed at the county health department. We do have there is someone on staff there that helps with indoor air pollution. Some of the programs are not best served at the local level and continue to be best served at the county level, and that's one of them.
What about wellness?
Wellness, I am now the wellness coordinator for employee wellness, and so I do have programs ongoing for employees. We have not had the advantage of some of the larger communities to be able to have a community wellness coordinator. That would be a long-term goal, as we're seeing more and more public health as we become more electronic and more sedentary. The problems and older. Chronic disease and avoidable disease is becoming an issue in public health. I think we need to tackle that.
What advice would you give people, let's say the public at large, as far as what kinds of things should they be thinking about as far as engaging in what I would call, or what you would define as a healthy lifestyle?
A healthy lifestyle, I think it starts with getting up out of the chair a little bit more. There's no magic pill, Bill. We're all looking for the magic pill.
Walk up and down those stairs.
Walk up and down those stairs. I've started a walking program at Town Hall. We're going out a couple of days a week on lunch hour. So a lot of the larger companies do that in the workplace. Bill, the cost of health care, we know, continues to skyrocket. Premiums aren't ever going to come down. We need to alter lifestyle of the people that we are insuring to get more into preventative care rather than fixing the problem. We want to try to prevent some of the problems, and that's where the savings are going to be in healthcare costs.
Now, you've identified a lot of work that you do as staff, and I don't recall seeing, I don't see any little helpers helping you out. So, the town has some volunteer support for this. That would be the board. How many people are on the board?
We have 5, and they are appointed by the selectmen, and they serve 3-year overlapping terms.
Okay, and how are you on population of that board?
We're at full capacity right now. The selectmen have just made their appointment for the next year, so we are at capacity. They meet once a month. We have a very, I've always been very proud of the support that I've gotten from the board. They're very well-rounded. We have several people in the medical profession. And we have a nurse, and we have someone who has owned a restaurant previously, so that gives very good insight with all of the food service. A realtor. So, I mean, we're looking at people It's a difficult board as far as there's a lot of science, there's a lot of plan review, but we also are fortunate to have a good cross-section of the community with real-world experience in the issues that we're enforcing.
So it looks like you have a good, good cross-section of business and professional people that, that have volunteered their time and energy to help
Yes.
support you. What is their role?
Their role is they're the policymaker. The authority from the local Board of Health comes from the state legislature through the state sanitary code. The state legislature, realizing the importance of health, do grant local boards their own ability to make rules and regulations, providing that they are reasonable, well thought out regulations. So some of the examples that the board has used that authority over the years is smoking in the workplace. That was a local regulation,
Was
not a
it?
state
Oh, I
regulation.
did not know that.
That started that movement. A lot of the cities and towns passed that before the state passed it statewide, banning smoking in the workplace, smoking in restaurants. So things like that have started. The boards have used their local authority to do that. They've taken that authority to go a little bit beyond some of the state regulations. For example, in swimming pools, it's up to the local Board of Health as to what type of safety should be at a pool. So the board enacted regulations stating that every swimming pool operator had to have people on site that were trained in CPR for emergency response.
Now, is that for residential pools as well as commercial ones?
Residential do not come under the Board of Health. Anything other than one house, one pool. So all of the motels, the condos, large public areas are licensed by the Board of Health. We have about 40 in town that we license regularly.
You mentioned CPR. When I received my CPR training, I was in the nuclear power industry, and I went to the Red Cross to get it. How would someone get CPR training here?
Either through the Red Cross, we have also set up cooperative classes with our own fire department.
Oh, okay.
We'll set them up every couple of years at Town Hall. We'll do CPR, we'll do food service training, things of interest to the folks that we are giving licenses to. We try to help out with education.
On the education piece, what do you see as the most important need for continuing education of our population?
Continuing education, I always say, just because I've been here and in town for 20-something years, the population is changing all the time. And I think as folks working in Town Hall, we have to remember that we have a very changing population. When we think that we've covered a subject 5 years ago, we always have a new part of the community moving in again that may not be up to speed on having a septic system, or why shouldn't I be using fertilizer down to the edge of the pond. So we have to dust off those education programs every few years. The subjects aren't always totally done.
Having said that, when we think about the continuing education piece, what would you recommend to to our people is if they had a particular interest in an education piece? How would they approach you? How would they get in touch with you to let's say, to make a suggestion?
You can reach us at our website. Give us a call. I meet with people on a regular basis.
When you say the website, is that the town's website?
The town's website.
So,
you can access.
and then just go down to the health department?
Yes.
Okay.
Yes.
When we get to the end of these things, one of the things that I ask the talent is, what would be the takeaway you would want people to have from knowing about the health department?
The things I continually try to stress is that I'm not just a regulator. I should be there as a resource and an educator in the community, whether it be someone doing a science project, someone opening a restaurant for the first time. Please make an appointment to come in and see us. We are there as a resource and not just the person with the clipboard.
Well, I think that we've pretty well covered all of the, we've watered all the flowers, as they say. And Paul, I want to thank you very much for spending the time with us. Folks, you've been watching Hands On Harwich, and today we've visited with our health department in Paula Champagne. Thank you very much for watching.
Thank you.